everybody and welcome to the first of 2 special webinars to mark International Overdose Awareness Day. We have 3 speakers today from across the world. My name is Jason Wallace. I'm a Senior Development Officer with the Scottish Drugs Forum. In today's webinar, we will be discussing the impact that networks of people who use drugs can have on changing drug policy around the world. People who use drugs have been creating unions, groups and networks to advocate for drug policy and practices that support harm reduction, health promotion and human rights. Today we will hear about the history of some of these movements, some of the challenges and some of the progress that's been made from advocates and activists in the Netherlands, Norway and the Ukraine. There will be an opportunity for questions in a panel discussion after the presentations. As I mentioned, we have 3 speakers. We have Theo Van Damme from the Netherlands. Then we will hear from Olga Belyaeva from Ukraine. And our last speaker will be Arid Kutsen from Norway. We'll hear from each speaker, then we'll have a question and answer session at the end. Attendees can submit questions throughout the webinar. You should have a questions tab that appears in your control panel, which should be on the right hand side of your screen. And my colleague Kirsten Horsborough, who is a Drug Death Prevention Strategy Coordinator, will join us for the discussion session at the end of the presentations, where she'll ask your questions to the panel. So before I introduce the first speaker, I'd just like to say a wee bit about some of the work that I and the SDF have been involved in recently in Glasgow, looking to set up a network for people who are actively using drugs. So around about 18 months ago, we identified that we don't hear the voices from active drug users throughout Scotland. So along with partners, we looked at setting up a network, and we've done this through a group that we called the City Centre Engagement Group in Glasgow. This group was set up to hear the views of people who are actively injecting or using substances in and around Glasgow city centre. And we set that group up with the purpose of creating a safe space where people could come together, have their voices heard and advocate for better drug treatment, better health, better opportunities for themselves and their community. That group's been very successful up to now. We've got 2 groups now established in Glasgow at either ends of the city centre. And up until COVID, we had very good engagement on a weekly basis with people who were actively using drugs or injecting drugs in and around the city centre of Glasgow. And that group had been involved in lots of different activities, sometimes consulting on alcohol and drug partnership work, sometimes consulting on work from the newly formed Drug Death Task Force, and sometimes consulting on subjects and pieces of work for other external partnerships. So I could maybe speak a wee bit later about some of that stuff in the panel discussion. But as I said, today we have 3 great speakers. The first of which is Theo Van Damme, who you'll see appearing on your screen in a moment. So Theo was the founder of LSD Foundation, the Dutch national interest group of drug users. And in preparation for this today, I was looking at some of the stuff Theo's been involved in, and I've picked out a couple of wee points. So in the early days of Theo's work, people often referred to him locally as the chief, but latterly people have been referring to Theo as the founding father of drug user movements in the Netherlands. In the early days, one of the pieces of work that Theo was involved in, he was asked to lead on HIV prevention for injecting drug users. and he accepted that and insisted on having 2 drug users as members of staff, but insisted that they were paid for that work. This idea, however, shocked people who asked Theo, but what if they buy heroin? To which Theo replied, well, that may be the case, but I don't actually know what anybody does with their money when they're paid it. Nonetheless, the 2 people did get paid for the work that they were involved in, and during that project they learnt some valuable lessons. So if I could just introduce Theo and ask him to put his camera on, and then we will hear from Theo. So
here we are. Yeah.
On you go, Theo.
Okay, thank you. My first point is that I would like to thank you that I can participate on this webinar. I never heard about a webinar, but I am in right now. So thanks for that. I will just give a very short, briefly overview about drug user history in the Netherlands, and especially in the interest of drug user organizations. I could start in the mid-80s as a harm reduction, AIDS prevention for injecting drug users. But after a couple of months, I found out it's not necessary to talk about safe use, safe sex. People get sick of it. So then I said, what do we need more? And that's the way it started, in fact, just to listen to people living on the street and just open my ears, open my eyes, and just try to make a kind of translation to those people who were really responsible for all of us. I started my first interest group, and the main goals were health promotion, because that was an issue to get some money on. So we said health promotion. And for me, it was important to bridge the gap with professional workers, with policymakers, and even with police. I got money for this project, and my first point was that I would like to have 2 paid field workers. And if I talk about paid field workers, I'm always thinking about a good payment, every month, a good payment. It's a serious job, and for a serious job, you need to be paid serious. As Jason mentioned, the first reaction of our government was, but maybe they will buy drugs for their money. So, yeah, maybe, but I don't know what you are doing with your money. So what are we talking about? They make one point: if people start to deal drugs, the money will be stopped for him or her. And in 1 month, there was one of our guys was put in prison because of dealing drugs. So I made a kind of joke. I told politicians, yeah, we are just infiltrating in prison for harm reduction activities in there, but we have to change our rules. From that time, we even had a lot of volunteers, and everybody could help on his own way. I was able to organize drug users in several cities. During the years, we had 24 local groups in the Netherlands, and I could invite everybody every 6 weeks to come over to one city in the Netherlands and have a meeting all together. We went every time to another city so people could show us what's going on in their place, and people loved it to come there. I could pay them immediately back their traveling costs, because as we all know, we don't have money, so immediately pay back the travel costs. And during all those meetings, we were talking about what's going on in every city. In that time, we were talking about the methadone programs. You have to come every day at the same time to get your methadone. We said that's ridiculous. If people are taking methadone for a couple of years, They know how to handle it. And if they sell it, okay, bad day. And that's what we all know. And we start to talk with social workers, with policymakers. And during the time, they took us more and more serious. We planned during our 6-week meeting, we planned actions. One moment we had an action with very small etiquettes, which said heroin free. And it was a terrible quality. It was just paper. But because it was just paper, when it got wet in the rain, and in the Netherlands we got a lot of rain, it's hard to get them off. And we put them on walls, on railway stations, in the train, at the police station, and some places they hang really there for more than a year because they couldn't get them off. For me, it has always been important to have a structure. As an organization, you have to be a serious partner for the people you are talking to, not only for drug users, but even for the policymakers. They need to trust you. They need to that they can count on you. So in my board, I always ask people with a more or less famous situation in a local situation. So our politicians were willing to spend some money on a serious program. I always have been very clear about money because during the years we got over 100,000 euros per year, and I couldn't get that money. I was always scared that the tax will check us 3 times, and the big company half the time. So it was clear for me that all the money, there is a responsible guy for that, and it has to be a non-user with a respectful situation in a local city. Just looking at my paper, we put a lot of actions on house rules in day center. We had a lot of day center, and they put on, it's not allowed to do this, not allowed to do that, it's not allowed to do this or that. And we always have, no, it's too much, it's not necessary. One moment we organized our own illegal consumption room because we were talking for months and months, and every month we met each other. And we didn't make any progress. And then I told them, I go. If you really will make a big step, I will be there. You can invite me. And I went to my office and I told the guys and girls, from now on, we can take drugs. It's open right now. People were happy with it, but everybody realized by himself that it could be closed the same day or after 2 days or a week or a year, who knows. And I asked the guys, do we need to have rules? And one guy told me, you have to behave normal. I said, put it on the billboard. And he did. And that was our only rule. Just behave normal. And everybody knows what it means. Don't pee on my table, I don't pee on your table. That's simple. And it works for more than a year. And then the police stopped it. I have to go to the police station. I said, no way, you have to find me. And however, the Netherlands is a small country. It's big enough to hide myself. And then we made an appointment for 1 week later. We will meet each other in a pub and talk about it. And they say, okay, it's not allowed to do anymore. If you are still open as a drug consumption room, we're gonna arrest you. Okay, so we have to stop. By this action, I know that our drug consumption rooms in Utrecht, the city where I'm talking about, just came earlier because everybody was scared to open a drug consumption room. And we weren't, we just did it. There was another point with police that I did for a couple of years already, a kind of safe use training. And we worked training sessions without nothing, just with clean needles, and that's it. And then I said, okay, I will have a real training. I will ask social workers, policemen to come to our training, and I ask 100 euros for a session. And from that money, I bought heroin, cocaine. And I asked some users to come to us and to show what it is to take drugs. Not only how it works when you take your drugs, but even how you react on it. And social workers were really happy because they never saw drug users taking his drugs. The policeman is only focusing on drug users, and they take off your heroin, cocaine, and they threw it away. So it was really a special moment, and for drug users, it was a big party almost, that they could take drugs in front of police, paid by police. But another police station heard about this, and they said, "Oh, Theo, you are dealing." No, I'm not dealing. I'm just handing out. And you pay me for a training session. I give it to my guys, girls, and they will just do what they are here for. So that's one of our special ways of working. I'm happy that I was in a possibility. I see my time is over. I'm the lucky one who was in a possibility to do this not only in the Netherlands. I could help user organizations all over Europe, and I'm doing that for a couple of years and support them. And I'm thrilled to still try to support drug user organizations all over Europe. And when something is going wrong, I always try to give my meaning, my advice. And this is it for now. Thank you.
Thank you, Theo. Thank you for a very practical and compassionate approach to people who use drugs. I would just like to introduce our next speaker, if she could just put her camera on. Our next speaker is Olga Belyaeva from Ukraine. Olga is a program coordinator for Eurasian network of people who use drugs. Olga is over 2 decades of harm reduction work. In 2010, Olga co-founded the Opiate Substitution Therapy Patients Association, known as SDF in Ukraine. This was the first of its kind in Eastern Europe and Central Asia region. And between 2013 and 2019, Olga worked at the Eurasian Harm Reduction Agency as the manager of their community-led advocacy programme From Street to Government. So Olga is just going to give us a wee presentation. Thank you.
Thank you. Good day. I'm Olga Belyaeva. ENPUD here. Yes, thank you. Here's our logo. ENPUD, we are from Eastern Europe, Central Asia, Eurasian network people who use drugs. We are here today because we still die from overdose and try to change the situation a lot of years and share what we do and get your experience and questions and life hacks how to save our lives. Why I'm here? Next slide, please. I met with Scotland in Glasgow 2 years ago. I'm in harm reduction program since 2000. When I was in the rehabilitation center, that's the time when I first time in my life I heard that in Amsterdam they have the program where the people who use drugs share the needle to save our Vienna. I was shocked. I was shocked because I never seen that for people who use drugs somebody care about people who use drugs. And from this moment my way is clear about the harm reduction. And when I was in 2000, but I didn't know, I didn't awareness about the overdose. I realized what is mean awareness of overdose when I came to Glasgow in our meeting with Scotland Drug Forum, with community about the overdose. And the first moment when Stephen met me, he asked me about if I have naloxone. I say no. He explained me what happened in Scotland. He gave me this bracelet. About it, I have naloxone, and he gave me the naloxone. And be very careful about if I have skills to use it. And thanks for this awareness, I can save my sister's life in Spain when we were in Spain, because all time the naloxone I have next to me, my body. And next slide, please. This is a moment when I realized what means the awareness of overdose. This about is our countries, Eastern Europe, Central Asia, about their condition. Repressive drug policy affected on us that we must feel alert in 20.7 to hear what's around us. If somebody hear me, who sit in the car next to my door, my house. There's some our drugs which we understand how to reduce harm, like cannabis, heroin, other opiates, poppy, and ephedrine, that remove from illegal drug scene. And now this illegal drug market is full in the synthetic drugs. And the drugs became more and more dangerous. Dangerous because not of the good pure. Dangerous because we don't know what is consist in this crystal. Of course, we have now the crystal meth and methadone with fentanyl. We have a lot of problems with alpha PVP. 30 years propaganda against people who use drugs bring us a big barrier to get the healthcare system. I explain a bit later about it. And usually, if you stay anywhere in the government organization or even in the neighborhoods, know that you are people who use drugs, the attitude is changing in the same moment, and you lost your rights, you lost your social connection. That's why people start to be invisible about this, that I'm using drugs. Next slide, please. This is an example how the stigma produced the torture against people who use drugs. 10 years in Kazakhstan have been implemented the OST program, 10 years, and still now we advocate that methadone could bring the hospital. Next slide, please. This is about our sub-region, and this is our colleague is harm reduction Eurasian network, Eurasian Harm Reduction Association product. This is a map. You can see that we don't have good access to naloxone, but on the practical level, this map is show that even people have naloxone. We don't have the systematically learning course about how to keep our skills to manage the situation with overdose. That's why just only give naloxone, like only give methadone. It's not about the harm reduction. It's about part of the program of HIV prevention. We don't have harm reduction in our countries. We have only one part of this big complex, prevention and treatment HIV, Hep C, and other disease, tuberculosis. That's why one of condition to come to OST, you must be HIV positive. That's why some people try to be infected, because in order to open the access to OST program in some countries. Next slide, please. About overdose, when I returned, I stayed in Lithuania last 7 years and came to your countries and learning from you how you create your program, how community strengthening our voice. And I returned months ago. And what I see here, that 17 people died during 1 month at this OST patients from overdose. And we started to realize how it's happened. It's OST patients, it's people who involved in medicine program. And we noted the stressful factor, the bad quality of OST pills, the negative connection between some system service providers, increase the risk of overdose. And of course, I ask people about you have naloxone? No. Even people who usually each day use crystal methadone, they don't have naloxone as usually it's in their pocket. We've bought some ampoules of naloxone, of course, but it's not a systematical. This is only to change the one to moment. And Belarus, as for COVID situation and what happened, in order to understand, even people come to legal program, OST program. Our brother from Minsk, he came from Belarus. He came to the program during 3 weeks. He felt very bad each day. Not good and more problem. But he afraid to say about his condition because he knows that nobody brought him to methadone to hospital. When he fall in the OST cabinet and brought to hospital, he died in the next day. That's why it's not about only that we are not care about our health. This more situation, this about the afraid to feedback and lose our even small rights when you come to medicine or other government services. Next slide, please. Another situation, if we don't know how to care about the opiate overdose. Another situation that we face now, a serious situation that 3-4 people die each other among our local community during the months because of the alpha PVP and pharma cocktails overdose. And this is, we have our life hacks, how to save each other. And this is another part of big problem that we try to understand what we must do it right now. Next slide, please. And shortly, what we do, we are in our community, Eurasian network people who use drugs. We are together in 12 countries, and we buy and share naloxone. We ask doctors in reanimation, doctor who knows to teach us to be more effective and have the skills. We collect the life hacks and share between us how to save, especially for salt overdose and NPS overdose. Of course, we take care about each other. A lot of time people invest in order to be online with people who are suffering from NPS overdose. At some moment, it invest 2 hours, some 2 days in order to be online with people and keep him or her in connection in order to people survive. And yes, we are looking option about how to go through the economical crisis because people who stay as a narcologist registration, we don't have access to the most of the job, and this is a problem. And we don't have a lot of skills to get some jobs. And now we feel and more seriously understanding that we need to create some social enterprises, some special for us in order to have for day by day money to have some basic needs, to have some basic drugs. small and it's not so much money, but we must think about it. And if you have some ideas, please share with us. Next slide, just only say thank you and introduce you, our Eurasian network, People Who Use Drugs. Thank you.
Thank you, Olga, for your insights into the challenges and tragic circumstances facing people who are using drugs in Ukraine. Thank you. So our last speaker of the day is Arid Kutsen from Norway. Arid is the lead for the Association for Humane Drug Policy. Arid has been a prominent and tireless Norwegian drug user activist for many years. Most recently, he's been campaigning for the decriminalisation of drug use and possession for personal use. And earlier this year, at the 63rd session of the Commission on Narcotics Drugs, the Minister for Health made an unprecedented and brave admission, noting that after 20 years of debate and disagreement, that Arid's view was actually right and the Minister had been wrong. Norway are now looking at adopting a Portuguese-style approach to decriminalisation. So we're going to hear from Arid now, if he'd like to put his camera on.
Hello, Jason, and thank you for the presentation. My name is Arid Knutsen. I'm the leader of the Association for Humane Drug Policy in Norway. That's one of 5 drug user organizations, and I'm a drug user activist. And we started up in 2006. And the reason why is that after we had only criminalization and prohibition in Norway, we started with harm reduction efforts in around in the 90s and to 2000, and in 2005 we got the first drug consumption room. And every debate about drug consumption room and harm reduction and substitution treatment, there was this one drug user organization that was called the Drug Abusers Organization, that was belonging to the temperance movement, and they were opposing harm reduction on behalf of the drug users as drug user representatives. They were opposing harm reduction and substitution treatment and decriminalization and legalization of drugs. So we understood that we needed some drug user representatives that could be for harm reduction. So therefore we started up in 2006, and we wanted more substitution treatment, more available access, and that one can choose which kind of medicine one wants to use, and that one can think about maybe substituting also other kinds of addictions. So in 2008, there were big political pressure on the drug consumption room. They were planning to close it down, and that fewer should receive substitution treatment, and that they should have more police actions against the open drug societies. So then we went together with street paper network and with the open drugs, those people in the open drug scenes, we went down and we made a rally. So we were demonstrating with banners and posters, and on our way up to stand outside the parliament and protest the drug policy, we got the news that we could come into the parliament. So we were invited in 2008, and since then this has been the Drug Users Day in November. Every year we go into the parliament and talk to each political party about how we can get a better drug policy. And after that, we have all the time been using the media, because media reaches out to the people, and the people reacted on this before the health directory, the health department, and the government. So they understood that what we were doing this in a respectful manner. We want to be included. We want a better society for us, and we want the society to be better for all of us. We want to live together in harmony, and the drug problems are so very bad. We have open drug scenes, people are living in very bad conditions, and very many people die of overdose, around 250 every year just in Norway, by heroin overdoses and other overdoses. So when I was working as a field worker, handing out drug user equipment. So then I suggested we should hand out antidote for heroin like naloxone, and we should have a switch campaign to inspire injecting drug users to start smoking heroin instead, and that we should every year have this Overdose Awareness Day on August 31st. And we did that the first time in 2013 in just outside the parliament. We marked that it was Overdose Awareness Day, and now that is marked in more than 40 communities in Norway every year. And we have naloxone in around 40 communities. This nasal spray is saving so many lives. And also very many of these communities has this switch campaign with heroin smoking foils, so that one can choose to smoke instead of just injecting heroin. And so we got a national overdose work from the parliament. And when we got our new health minister, he was opposing this, like you said in the presentation, Jason. He was opposing harm reduction, he was opposing decriminalization, and he's a conservative politician also. Then when he was Minister of Health, he had to travel around in Norway and present this overdose prevention program. And then he didn't understand how to do that, so he had to bring me along with him around in the country. And preventing overdoses with the switch campaign, naloxone, and so on, it's more pragmatic and tolerant than any politics has been on this area before. So I think he learned very much from that. And in 2016, all the drug user organization came to us, and we had this petition in a newspaper with the famous politicians and famous people from culture, from the law, and from and many people signed our petition that we should decriminalize use and possession of drugs, and that and the petition was called "Nothing About Us Without Us." You can't have a good evidence-based and human rights-based politics without talking with those people involved, with drug users. If you're on drugs, if you're off drugs, if you're in substitution treatment, or if you just support us, then come to us and help us to find a good drug policy. So then the health minister changed his opinion and answered us that yes, we have to decriminalize drugs. So now we have had a committee looking into it and looking at all knowledge about this, and to criminalize use and possession of drugs does only harm. It doesn't do no good. And when you stop criminalizing people and treating like us like criminals because we use drugs, then there's some limitations on how far you can go to help people with drug problems, because it's an opposition to criminalization. So now that it is being decriminalized, I think the parliament will vote in a good model for next year. Then you see that it opens up to change the drug care system. So now we are making the substitution program better. We have had until now just heroin injection sites, and now it's turned into a drug consumption room where you also can use other drugs and where you can use it in different ways. So now they are opening up so that you can also smoke heroin on the drug consumption room. And also it's soon available now in the two largest cities in Norway, Oslo and Bergen, heroin treatment programs, clinics where you can come and get legal heroin 2 times a day. So the drug policy is changing now. We have a drug policy reform, and we are very happy that the health minister is cooperating with us and promoting our work. And we have been to many conferences in the world and in the Commission on Narcotic Drugs, the UN building, and told about the drug policy reform. And the UNODC, the UN's drug control board, they received it very positively. Also, the World Health Organizations and many international very important organizations, they favor this model with a drug policy reform.
Okay, excellent, Arid, thank you. So this part is a chance for the attendees to ask questions. If we can just have everyone back on the screen, and we'll be joined by my colleague Kirsten Horsborough, who will be fielding the questions from the attendees.
Yeah, if everybody could just rejoin, that would be great.
Yeah.
So that was awesome. Thanks very much for everybody's contributions there. And we certainly had lots of positive feedback in the questions. Lots of thanks to you all for contributing, and that it's quite fascinating. I think the reason it's often quite fascinating what you're talking about maybe feels like normal practice for you in your areas, but I think a lot of the comments that have come in from people are working or are involved in harm reduction in areas where they don't have strong networks of people who use drugs. So your contributions have been really useful.
Absolutely, and can I just say before you ask the questions, thank you for coming and joining us today, and it was great to hear from the three of you, and lots of great ideas that are very inspiring for myself and other people who are looking at how we set up these networks. So there was some really good stuff there about how to engage with the governments and the media, and some of the stuff that was mentioned about actually paying people for the work that they're involved in. So thank you for coming along, Kirsten.
Thank you. So normally what I would do, Jason, is just ask the questions and then you would direct them to who you feel is more appropriate to answer them, if that's okay.
Okay.
So we have, and maybe everybody wants to contribute on them as well, which is fine. It's just so that we can get through as many as possible. So first one would be just combining a few together. What is the key difference that people who use drugs can make in the process of making or inputting to drug policies?
Okay, and I think we'll start with yourself, Theo.
It's a big question.
Maybe you can repeat it for me.
No problem. What would you say is the key difference that people who use drugs can make when being involved in changing drug policy?
I think if you would like to be involved in drug policy, you have to be a kind of organization of drug users. And what Arild, in fact, told us all the time, cooperate, keep in contact with what we've in the early beginning called our enemies. Right now, they are just partners. And I think if you would like to cooperate, if you would like to bridge the gap, and people can count on you, then you can make any steps. Is that an answer?
Yeah, Thank you.
Just political
Would you like
nonsense.
just add something to that?
I would love to add some to that. I think that we are considered as enemies of society, and that we're not resources. We are just seen as drug users, drug abusers, and we need to be looked at as those resources that we are, so they can see the human behind the drug users, because we are so much more than drug users. And so we can run democratic organizations, we can cooperate with the politicians and those in the healthcare system, and then they learn that we are as good as them and that we are important resources, and to share our perspective of the drug policy issues is very helpful for politicians and everyone who works in this field.
Thank you. Kirsten, do you have?
Okay. Yeah, sure. I was just going to come to Olga, because Olga, I know you had some questions for Harold and Theo that you put in our little chat box, so feel free to ask them publicly.
Yes, Theo, if I understand correctly, the community have problems now with coming to safe consumption room in Holland, yes, in Amsterdam. And
Yeah,
what
no,
happened because of policeman activities, and how it has been occurred? What happened?
it happens sometimes that police will have problems with drug consumption room, but right now we have, I don't know the number, but it's over 80 different drug consumption rooms all over the Netherlands. And some users, they say it's other type of heroin they hand out. And it's more about the heroin programs. And in the drug consumption rooms, we were not allowed to sell drugs. However, everybody knows we have some kind of experiments by house dealers. And yeah, it's always tricky, it's always risky. But if you need to have drugs, it's better to get them in the house than outside on the street, because citizens don't like to see all those movings around with users looking for their dough. And then police will make sometimes some problems. Sometimes you even can tackle that in a very simple way. I remember I was in Croatia, in Zagreb, and we had a kind of cooperation with the Red Cross over there, and there people could get clean syringes, vitamin C acid, and so on. But police was standing in front of the door all day when it was open. And I just suggested, bring them a cup of coffee. So the workers every time brought them a cup of coffee to the police car and just have a nice chat for 2 minutes and walk away. And the day after, they exactly did the same. So in time, it was not interesting to look for junkies. It was just a nice place to get a free coffee. And that changed a lot in that time. And that was in Croatia, not the most open society comparing to the Netherlands. So you can do it all over the world. Because, yeah, I always call it a kind of tricks. And I'm so happy to hear Harold and to hear you that the way I started, nobody would like to talk to junkies. We were just fucking up junkies. That's it. We were not allowed to went to a conference. The first international harm reduction conference I went to, I had to pay. I said, I don't have any money. So we stand in front of the door with a group of 10 drug users, and we said, we will get in and we will participate. You will learn a lot of us. Otherwise, we make a lot of problems in front of the door. And then they were thinking, shit, what can we do? And then we were allowed to get in, and it was the first time that drug users visited the harm reduction conference. And now we are just part of it. So there is a lot of progress. And so it really works when you show your face, when you work on this issue. We just create a better world for all of us, I hope.
Thank you.
Okay.
Thank you. May I ask questions in yeah? Thank you, Norway. Happy too that you opened the heroin medicine, heroin and OST. It's beautiful news. What about the you mentioned that you work, and I hear about it before, to prevent people from overdose, to move from injection way to nasal way, how to use drugs. But intervention way, it's cheaper and more high effect. How you facilitate with this issue to motivate people to leave injection way to nasal, to use another variant?
Actually, thank you for the question. It's not about nasal, it's about smoking heroin. And very many people have myths about heroin smoking, that you have to inject it. When you inject it, you become more addicted. You feel like treated like junkie, so it's harder to be in a life when you're injecting heroin. And when you're smoking heroin, the heroin takes more time to start to work, and then it works for a longer time. And you don't need that much, because you can easily choose how much to use every time, opposed to when you inject. So people find out quite fast that smoking heroin is much cheaper than injecting it. So we are traveling around to low threshold facilities and so on, and we are using sugar, because sugar acts on the smoky foils quite similar to how heroin. So I smoke a lot of sugar. It doesn't have the same consequences, but you might get a little sweet.
I remember that for the International Drug Use Day we organized at the 1st of November for 8 years, I think it was, that the day before we had a kind of, we call it training session for people from abroad, because they were all fixing. And we just said it's better to smoke, it's less risky, because our International Drug Use Day was a kind of conference and people were allowed to take drugs all day. And it's more a social happening to smoke than when you make a fix. It's more a private thing. And if you would like to enjoy drugs, have fun with it, it's better to do it in a group and not alone on your own basement. And people like to do it. And people love it.
If you can stop with a needle when you're not ready to stop with heroin yet, call your parents, because they are jumping in the couch. They are thinking you're dead of overdose every time the phone calls. But when you have switched from injecting to smoking heroin, call your parents and tell them, because the next time the phone is ringing, they will jump of joy and think it's you who's calling them. It's much, much more safer to smoke than to inject heroin. And if you want to quit heroin sometimes, quit the needle first, because that's hard. That's very hard.
I agree.
Thank you. Do we have any more questions, Kirsten?
We certainly do. So I'm going to do my best to try and lump some more together. If it's okay with everybody, we'll go on to 2:05, since we were slightly late to start. So just add on a few minutes so we can get some more time for questions, if that's okay. So there was a comment particularly about what you presented, Olga, on the deaths among people who were on opioid substitution therapy. It was really sad, and the question was, is there any quality assurance or inspection of these types of services? Because that's something that we're trying to do in Scotland. Do you need me to repeat? So with the OST programme in Ukraine, is there any kind of quality assurance or inspection of the services that provide OST to make sure that it is the best type of service available to people?
Mhm.
Do people monitor the service?
Yes, I understand. This is for Ukraine and for all our countries. This is the moment when the meaning of understanding what the substitution treatment program is meaning is changed when it's come. This is method. This is approach come to our region. Problem that they understand. They thought that if they give only pill, that the people must change their life the same moment to go to work. Our indicator, I must go to study, to take a job, to improve my relation with family. It's not in any indicator about how I feel, my feeling of happiness, my feeling of how my stress, my level of stress, each day stress, and how it's reduced. And this is the moment that we don't only care about it and why we are in drug policy. We know we come to drug policy in our countries when we realize that our government, our people, our experts do the wrong way. They lost the main moment, what you say now. If you want to join drugs, you should be awareness about what you use, how to use, understanding what you expect and who can help you. And this is, we community organization create this space for awareness of using drugs. And this is part of prevention. This is part of stay alive. And I think the main point for our countries, this is the moment we don't have insurance, we don't have any, we have only obligation. If you get OST, you must 1, 2, 3, 4, 5, 6, 7, 10, and your life only around the drug addiction center. Another variant we don't have. That's why we are thinking and speak about we have a lot of money for HIV prevention, but we don't care. We think now to open the discussion about, guys, yes, it's good, HIV, Hep C prevention, but it's only small part of the harm reduction. If we say that we have harm reduction, it must be five pills in the OST program, I mean medicine, heroin, morphine, buprenorphine, and other in OST program, and supporting drop-in centers, shelters, involve people to be to feel love, to feel caring about him. Just this is the basic when people thinking that we have some point to change our life to another way. If I answer, I try do my best to answer this question. Maybe my brother help me. And one point, may I say one point? The main issue, this is the quality of OST for Ukraine, because we have the government bought these OST pills, the cheaper price, and cheaper price. It's not about the economic. This is not economic. That's why people give their OST and exchange OST for crystal methadone in order to feel good, like they want to feel an OST program. I returned from European country. I can get OST in Ukraine because I compare my OST pills when I took in Europe and now in Ukraine. This is absolutely another. This is not substitution treatment. This is the point. It's the quality of each moment of implementation of the harm reduction program, and keep the meaning from the beginning to the each day implementation. That's why we are here. Thank you.
So this shows that in all different countries there is a need to have a different way of working. The basic rules of harm reduction are the same all over the world, from my opinion, but for every national program It's total different. In the Netherlands, we don't have that big numbers of overdoses. And we don't walk around with naloxone, because it almost never happened that people die from heroin in the Netherlands. And the relation that Arad has with the politicians is quite unique all over the world. But I would like to invite the people in Scotland to find their own way to organize a drug user union, which will be strong in a couple of years, for sure. It's possible. It's a hard way to start, but if you're working on it, you can't stop. So keep on going.
Thank you.
And please check out Drug Reporters video series about the international network of people using drugs and all drug users organization. It's called Taking Back What's Ours. It's on YouTube.
Thank you, Aaron.
Thanks, and I think that was, I've shared the Drugs Reporter series quite a few times, so I'll put a link to that out as well. I think, unfortunately, we've run out of time. We had so many other good questions there as well, and we probably could have kept you here for another hour or more. But what we will do is we will email the presenters these questions and get some answers to those for the people who've asked them, if that's okay.
Sure.
And so, some people have asked whether they would be able to get future access to these presentations, and they will be available on Scottish Drugs Forum's YouTube channel. So Jason, final word over to you before we end.
Thank you, Kirsten, and thanks again to the speakers for coming today. So, as Kirsten said, unfortunately, we've came to the end of the webinar, but this has been recorded and it will be published on the Scottish Drug Forum's YouTube channel as soon as possible. You can also view all of the previous webinars there. We'll be sending out an evaluation, and it would be excellent if you could complete this for us. The second of the two special international webinars will be held next Friday on the 28th at 1 p.m. and this webinar will focus on dual public health emergency of COVID-19 drug-related deaths, and we will have speakers from Canada and Australia. A link to register for this webinar will be included in the evaluation email that you receive, so it would be great to have you to join us again. And finally, I'd just like to thank everybody again for attending, and special thanks to the speakers who gave me some ideas, and it was great listening to everybody and their shared experiences. It was very interesting and informative. So thanks again and goodbye from us, and we'll see you next week. Thanks, speakers.
Bye-bye.
Bye.